Hello, I'm Dr. Jay Shannon. We live and breathe our mission every day, so we already know that Cook County Health is one of the best kept secrets in healthcare. We're home to top doctors, excellent staff, state-of-the-art technology, and research that changes lives. We're modernizing our facilities to match our staff's talents and our patients' needs. And our service offerings are on par with, and many times exceed, those of other health systems. But many people don't know about the life-saving and life-changing care we deliver every day. These stories need to be told. And we're launching an exciting new campaign to do just that. As healthcare becomes more competitive and more complex, there's never been a more important time for a campaign like this. While it's impossible to include every story in every department, we're pleased to share many of the exciting changes and achievements underway in our system. And this is just the beginning.
At Cook County, your health is our priority at every stage of life. Your journey to motherhood begins with prenatal care that's close to home, in private labor and delivery suites. You can count on our obstetricians, pediatricians, neonatal specialists, and family doctors with expertise in everything from asthma to complex pediatric cancers. Our team of primary care physicians is focused on keeping your entire family healthy, with convenient hours and locations throughout Cook County, so you can focus on what matters. When you need expert care, we have the experts in diabetes, mental health and substance abuse, stroke, burns, HIV/AIDS, and much more. And state-of-the-art ophthalmology facilities for everything from routine cataract surgery to full corneal transplants. In the fight against cancer, we'll stand by your side. Our nationally accredited cancer care program offers the most advanced, cutting-edge technology and treatments available. We're proud that our patients, stage by stage, do as well as those treated at the finest cancer programs in the country. Whether it's cardiovascular care or orthopedics, nephrology or neurology, our experts and innovative treatments are available to everyone. Our nurses, technicians, therapists, and staff are among the most experienced in their fields. And of course, we are a national leader in emergency medicine. Our resident training program is one of the most competitive in the country, and our Level 1 Trauma Center, the first comprehensive trauma unit in the nation, is respected internationally. We even train doctors for the U.S. Navy. Honors? We've earned dozens for high quality and safety. Experts? We've got them, recognized nationally and internationally by their peers. The future? We're invested in a $150 million outpatient expansion and modernization project, all while reducing our use of local tax dollars by 75%. And that's just the start. We've served the people of Cook County for more than 180 years. We're ready to serve them now with today's modern medicine. We are Cook County Health. Look at us now.
Over the next several months, this campaign will share stories that should make us all proud of the work we do. There are many more stories we need to tell, and we need your help to tell them. Please continue spreading the word about the great things happening at Cook County Health. Tell your friends, your families, and most importantly, our patients. And tell the people of Cook County to look at us now.
What a great video. Good evening. All right, I'm going to do this again. Now, for those of you that don't know, President Preckwinkle is in the house, and she always insists you respond to a good evening or something. So I'm giving you a practice because she's going to do it. Good evening. There you go, much better. President, I got them warmed up for you. My name is Joe Flanagan. I am the chairman of the Cook County Health Foundation Board, and I'm pleased to have you here at our fourth annual gala. This is a sellout crowd tonight, so thank you all for making the time and the energy. Thank you. I'm honored to serve on the Cook County Health Foundation Board, which was formed in 2011 to help the Cook County Health and Hospital System continue to diminish its reliance on public funding while helping it address its mission of continuing to evolve and meet the changing healthcare needs of the public in Cook County. The mission of the hospital is to provide health care to everyone in the county, regardless of their ability to pay. The foundation's mission is to advocate and raise money and funds for programs and services that improve the quality of care for everybody in the county. And one of the newer initiatives we had as a foundation is continuing to build relationship with nonprofits throughout the county and beginning to really connect with the corporate and civic community, which makes the Chicago Community Trust honoring Dr. Gayle so appropriate at this time in our history. Today we've got 14 board members, and I'm going to ask each of you to stand when I read your name and hold your applause, the roaring applause. But I first wanted to thank and recognize Fred Lebed, who is the immediate past chair, who did a great job of building this organization. And thank you, Fred, for all that you've done for all of us. Our vice chairs are, and again, please stand and get recognized and hold the applause. Abe Thompson, Isabel Guzin, Lori Montana, Susan Wiemeyer, and our directors at large are Brian Bernardoni, Dr. Phil Sheridan, Mr. James Otta, Mr. Robert Henderson, Mr. Bill Kling, Mr. Peter O'Brien, Mr. Picaro, Dan Picaro, and our wonderful associate board chair, Lindsay Zimmerman. If you could raise your hand, and thanks for all these wonderful. And I want to thank the associate board that helped us check in and helping us work this event. They've done an amazing job, and they have been wonderful at building community and raising the awareness, looking at us now, of the health system throughout in the younger generation. So it's we're so lucky to have Lindsay and her leadership and the rest of the team. So thanks again. I want to thank our sponsors. Our sponsors, the names are up on the board. They're going to be rolling throughout the whole thing. It is amazing to the folks that have helped us, and we thank so much. Thanks especially Grosvenor Capital Management and Methode Electronics for their wonderful support of this event. But probably most importantly, I want to thank the doctors, the nurses, and the team members that are here tonight from the Cook County Health System. If you're a member of the hospital team, I'd like you to stand, and please, let's recognize them as well. Thank you all for your outstanding dedication and commitment. We're grateful that you've decided to work at the Cook County Health System and the wonderful work you do. I've had the pleasure of seeing it time and time again, so thank you. It's great. I want to also take a minute to thank the real brains and the power behind this operation. Lori Montana, one of our board members, Pam, Paul, and Danielle Stills, who really made all this thing happen, so thank you. And I'd like to welcome some dignitaries who took the time out of their busy schedules to come tonight. Bola Delano from the State Controller Susanna Mendoza's office. I'm getting too many Montanas here, sorry. From the Cook County Commissioner Dennis Deere, Cook County Commissioner Stanley Moore, Cook County Commissioner Bridget Gaynor, and Cook County Commissioner Deborah Sims. Thank you for coming. I'd like to also welcome the chairman of the Cook County Health System Board, Mr. Hill Hammock. Thank you, Hill. And a special guest here, I'd like to recognize and thank our First Lady of the great state of Illinois, Diana Rahner. Diana, welcome. For a couple of reasons. One, she works every day for women and children through the great work she does at the Ounce of Prevention Fund. And few people know this, but she and her husband, Governor Bruce Rahner, were the very first contributors to this foundation back in 2011. So Diana, thank you for all your support through the years. And I want to thank a incredibly strong advocate for the health system, Cook County Board President and tonight's honorary chair, Toni Preckwinkle. Thanks. Before I introduce Dr. Shannon, a man who is bigger than life on screen and in life, I wanted to tell you 5 things that I've learned in my time at the hospital that some people that don't work at the hospital may not know. It's pretty cool. This is, the Cook Stroger is the busiest trauma center in the Midwest by far. A little love, a little love. The first blood bank in the world was started at the Cook County Health System in 1937. There you go. There is an outpatient pharmacy at the system that cranks out 2 million prescriptions a year. Part of it's at the hospital and they've got another part, but it's an amazing system that people have there. They serve over 40,000 patients with diabetes every year. And in the emergency room, this is one of 2 hospitals in the country that the Navy sends their doctors to prepare for the work that they do in the battlefield. So it's a wonderful hospital. If you haven't had the chance to be there, it's a great place. And now I'd like to introduce our first speaker, a man who needs no introduction. Dr. Shannon was appointed the CEO in 2014 to one of the largest public health care systems in the country, serving over 3,000 patients a year. For the last 4 years, Dr. Shannon has been named to the Becker's list of 100 great physician leaders. He is one of the, quote, CEOs to know. And Doc, I had my list, you were in the top 5. So. Dr. Shannon currently serves on the Board of Trustees of the Illinois Hospital Association, is a director of the board of the Greater Chicago Food Depository. He's a fellow of the Institute of Medicine in Chicago, and he also serves on the Board of Trustees of Spring Hill College. I'd like to welcome and thank Dr. Shannon for his leadership and for coming tonight.
Thanks, Joe. Well, thank you, Joe, for that kind introduction, and it's a thrill to be here. As a matter of fact, it's my 4-year anniversary today as CEO. I bet, Hill, you didn't know that, did you? So I'm Jay Shannon. It's my privilege to lead this important health system. I've spent the majority of my career as a physician in public health care systems, and what I'm most proud to say of is that I've been with the Cook County system for almost 20 years. Ours is a storied healthcare system. It's been around for almost 180 years. Believe it or not, through 37 presidents of the United States. We have an important history of training, of clinical discovery, particularly for vulnerable populations, but most importantly, and what we're here about tonight, is around providing quality health care to the communities that we've served. This is particularly poignant to me on a week like this one, where there's so much controversy and so much uncertainty about the moral compass of our country as it relates to immigrants. We've been an organization that has always welcomed the immigrants to Chicago and to Cook County. Now, Joe took a little bit of the wind out of my talk with some of his recognition of people who are here, but I've got to spend a few minutes talking about a couple of the key leaders that have really helped the organization reach its success. And that list starts with County Board President Toni Preckwinkle. It's critically important for everybody in this room to understand that President Preckwinkle has been the most indefatigable champion of our healthcare system since her tenure here. She laid her political capital on the line, helping us to go to Washington many years ago to get a waiver from the Centers for Medicare and Medicaid that led to the beginning of County Care, our Medicaid health plan that today serves more than 330,000 Medicaid enrollees in Cook County. In addition to that, she has been a steadfast supporter of the health system, advocating for the rights to health care of the poor. And I think, again, the coincidence, if it is that, of President Preckwinkle and Dr. Gayle speaking tonight. Many of you may have seen this morning an article in the Sun-Times with Dr. Gayle talking about a critical problem in Cook County, which is inequity. President Preckwinkle has been directly supporting addressing those inequities that we see that are really social justice issues, both around public safety, around our carceral system, but also around public health. And her support can't be substituted for, can't be overestimated. Similarly, the support from the Cook County Commissioners has been critical, particularly as we've gone through challenging times, as healthcare is more complex, as healthcare is more expensive. The Cook County Commissioner's support for that mission is critically important. It's important for everybody here to recognize that not every municipality, not every county has taken up that responsibility of providing health care for the poor, and our commissioners have stood strong in that regard. I'm terribly grateful to our board of directors. They put in countless hours with multitude of committee meetings, overseeing policy, strategy, and execution of that strategy by the healthcare system's leadership. Joining us tonight, in addition to Chair Hammock, are directors David Munar, Emily Junge, Mary Driscoll, and Mary Guggenheim. I'm terribly grateful to those directors. I also want to thank the foundation directors for their support. As Joe pointed out, our foundation is just getting its footing, and I've been telling people tonight that this morning my wife was telling me, why aren't, everybody from the Hilton has to cover their ears for a second. She said, why aren't we having it at that cool place where there was last year? And I said, well, it's not big enough. It's not big enough to hold the crowd anymore. And that's in part due to the effectiveness of our foundation board of directors. So I'm terribly grateful for all of those directors and the time that they put in getting the word out about us. I'm particularly grateful tonight to Dr. Helene Gayle, who's a newcomer to Chicago, but came here in part because she knows of the impact that her leadership and the leadership of the Chicago Community Trust can have on directly impacting some of those major inequities that we see here in the Chicagoland area and in Cook County. And I think we're going to hear a little bit more about that tonight with the conversation that she and President Preckwinkle have. So thank you, Dr. Gayle, for coming. I think it's critically important tonight to recognize and thank the frontline staff that are the ones who are really at the sharp edge, delivering care to our patients every single day. Dr. Flanagan, Joe, you just got an honorary degree. Joe Flanagan had our staff stand up to be recognized. I want to give a particular shout out to table 13. Now, where's table 13? Where are my guests at table 13? Where are you? If you could all stand up. These are staff, these are clinical staff, nurses, operational leaders, environmental service workers, social workers. The reason that I asked them to come is that they've all been recognized by their peers over the course of the last year for the patient-centered focus that they bring to their individual role functions in the health system. So I'm particularly thrilled to have them as our guests tonight. Now, you're going to hear a little bit more about our Women and Children's Services through the course of the evening. I want to just point out and introduce a few of our medical leaders in that regard. Dr. Ed Lynn, our Chair of Obstetrics and Gynecology. Dr. Mark Loafman, Chair of Family and Community Medicine. Dr. Mopi Akintoran, who leads our pediatric services. So tonight we celebrate our Women and Children's Services, and we're proud of the services that we supply in that regard to the most vulnerable communities in Cook County, from primary care to highly complex care. We've got everything from community-based services and WIC services in our community-based health centers, all the way up through level 1 burn and trauma services, complex HIV care and oncology services, care for women past childbearing years. And our medical staff, it can't be surpassed. But it's also important to recognize that those folks who are driving those services are doing that because they believe in the mission of the organization. We've been terribly lucky because of some good fortune in creating our health plan, in better stewardship of dollars that we have, in better clinical operations, that we've been able to make investments over the last couple of years in long overdue capital needs. We've developed over the last year and a half, under the able leadership of Deborah Carey, our COO, and Sam Williams, our Executive Director of Facilities, a beautiful Women and Children's Center that's now nested on the 4th floor of Stroger Hospital, where we've got everything from ambulatory services to complex advanced inpatient services. That service, by the way, has a rather dull name right now. It's just the Women and Children's Center. Anybody with a few extra $1 million, we could have a conversation about your name going down in history for Women and Children's Services here. So give me your card after the dinner, and we'll talk. But I'm terribly grateful to all of you. I'm terribly grateful to our foundation sponsors, to our commercial sponsors who have bought tables this evening, and I hope that your giving won't end at buying the tables. We're a great institution. We've been around for 180 years. It's our intention to be here for another 180 years. We'll do that with your support. Thank you very much. Enjoy your dinner.
Good evening. I hope you enjoyed your delicious meal. As you know, this year's gala is raising critical funds for the Cook County Health System's new Women and Children's Health Center. There you go, there you go. Doc, is it still unnamed? Unnamed. The health system serves 100,000 women and children every year. 1 out of every 10 babies born in Chicago is considered high risk. And the health system, the county health system, cares for an unbelievably disproportionate amount of those families. There's a growing need in the community for critical support of the Cook County Health Fund, and we're here to help build that support. So we have a really interesting conversation planned for tonight. We're going to really focus and touch on the importance of women and children's health in the context of public health. I'm honored tonight to introduce the honorary chair of this year's gala, Cook County President Toni Preckwinkle. The president, a huge advocate for the system, has served as the president of Cook County since December 2010, and before that she served 19 years as an alderman in the 4th Ward, serving Hyde Park, right? She's been pivotal in supporting all assets of the hospital and has gladly accepted the opportunity to help us tonight. Please join me in welcoming Cook County President Toni Preckwinkle.
Good evening. Very good, very good. So I would be remiss tonight if I didn't begin by thanking Joe Flanagan and all the folks on the foundation board. I'm very grateful to you for putting on this great event. Best attendance we've ever had. I want to thank as well Dr. Jay Shannon and all the staff of our health and hospital system for the good work they do day in and day out. And Hill Hammock and the board of our health and hospital system, our independent governing board, which is staffed entirely by volunteers. This is not a paid board, so I'm very grateful to Hill Hammock and the whole crew. Thank you all. So I have the opportunity to introduce Dr. Helene Gayle. I'm grateful to the Chicago Sun-Times. They did me a favor today by running a full page on Chicago Community Trust President. City must address inexcusable inequities. So that's our introduction to Dr. Helene Gayle. She's president and CEO of the Chicago Community Trust, one of the nation's leading community foundations. The trust works with donors, not-for-profits, community leaders, and residents to lead and inspire philanthropic efforts that improve the quality of life for residents in the Chicago area. For almost a decade, Dr. Gayle was president and CEO of CARE, a leading international humanitarian organization whose poverty-fighting programs reached over 97 million people in 87 countries. An expert on global development, humanitarian, and health issues, she also spent 20 years with the Centers for Disease Control in Atlanta, focused primarily on combating HIV and AIDS. Please join me in welcoming the Chicago Community Trust CEO, Dr. Helene Gayle. So Chicago is often described as a quintessential American city. What have you learned about our city that surprised you or interested you? What challenges do you see ahead of us?
Well, you know, one of the first impressions that I had when I came here was really how welcoming this city was. And I laugh because, you know, I've spent so much of my time in kind of coastal cities where people have a lot of edge, and I came here and, you know, I'd go into stores and people would ask me, can they help me? And I was like, you know, what's up? You know, what's the angle? And then I realized they were actually just trying to be nice. And so, you know, people bump into you in the street and they say, I'm sorry. And so, you know, it took me a while to just get used to the niceness that I think is very real here. And, you know, and we were talking about it at the table, you know, I think there is a real civic pride here that I haven't seen in any other city that I've lived in, and I've lived in 8 cities or so around the country. And there's this real deep sense of pride in Chicago, a real, yeah. You know, it's one of the cities that people come back to. And people leave, go get their education, start their careers, but people want to come back. And I felt like there was this incredible desire to be the best that Chicago could be. And to me, that was really very, very compelling. So, you know, it was one of the things that I think that impressed me the most in the time that I've been here. That said, to your point about my this article in the Sun-Times, you know, the other side of that is while I feel there's this incredible sense of commitment to Chicago, incredible sense of goodwill, you know, this is a city that has huge inequities. And, you know, when I, as a health professional, but very captivated by some of the statistics that talk about the life expectancy if you live in the downtown in the Loop area or some of the wealthier neighborhoods. Higher life expectancy than the average US life expectancy, 82, in some neighborhoods even 85 years of age, but you go 5 miles in another direction and that life expectancy drops by 16 years. Now that's the kind of gap that you see between countries, not within a city itself. And so, you know, those are the kinds of things that, you know, I feel, you know, on one hand, you have this incredibly committed city that wants to be the best that it can be, and lots of resources and lots of assets, but it hasn't all added up. And I think there's an opportunity to take those assets, take that goodwill, and look at how can we be an example nationally and maybe even internationally for how you heal some of those divides.
What role do you see the trust playing in addressing the inequalities?
Well, we're stepping back, and I'm new. I didn't come in here with an agenda. What I really wanted to do was to listen, to learn, and really think about what are some of the things that the Trust, which has been a trusted partner in the Chicagoland region for 103 years, that I think has a lot of goodwill and opportunity to continue to contribute. How can the Trust, and with me and the team there, do more to help heal some of those divides? How can we work with partners? How can we use the resources? We're well-resourced, but we want to do more than just be a grant maker. We give out resources to the community, that's important, but can we take those resources and be catalytic and really help to bring about some of the changes, working in partnership with the government, private sector, really be a catalyst for bringing people together to start healing some of those divides.
One of the areas that you talked about in terms of inequality and disparities is healthcare. Is there going to be a particular focus on addressing those, for example, life expectancy inequities? Yeah, well, one of the things that, and I saw this a lot in my international work, is that sometimes looking at these issues, if we don't address the root causes, we're not really going to make the difference in the long run. And I'm a big believer in what we talk about in public health as the social determinants of health, that while it is so important to get good access to health services and to have a strong health system like Cook County, that if we don't think about the root causes for health disparities, we know that medical care really only has a small proportion, has a small impact overall on addressing disparities. What really matters is, do people have access to good education? Do they have access to jobs, transportation to get to jobs, access to grocery stores where they can actually get high quality food? So, really looking at these issues that are broader than a health system. A health system and having an excellent health system is a cornerstone, but if we're not attacking some of these kind of social determinants of health, we're not going to have a dent in those kinds of health disparities. So if we don't invest in the health of our communities, we're not going to have an impact on
individual health. Right.
Yeah.
We have to have healthy communities to have healthy individuals.
Okay. We're focused tonight particularly on the health of women and children. Is there any particular lens that you bring to that?
Well, first and foremost, I'm a pediatrician. So as a pediatrician...
Did you practice?
I practiced a little bit and then went into public health.
Wow, okay.
But pediatrics is my roots. I believe if we don't have a strong focus on children and children's well-being, that communities don't thrive. And so I think it starts with children and women and mothers. We have in this country the highest maternal mortality of any industrialized nation in the world. Again, that's inexcusable. We shouldn't, something that is as natural as childbirth shouldn't be a death sentence for many people in this country. And so, I think those issues, those fundamental issues of women and children's health are so core to communities. And I think how we treat women and children is a reflection of how we value our communities overall.
So I'm going to ask you a loaded, thank you. I'm going to ask you a loaded question. We're coming up in Chicago on a mayoral race. What issues do you think we need to speak to as we look at the next 4 years?
Well, I wish that politicians had the ability to have a long view, because I worry, and this is not unique to Chicago. I always worry that that because elections get, just like we were talking about corporations and short-term thinking, means
quarterly reports.
Quarterly reports, exactly. Election cycles are a bit like that, where people don't have the luxury, or don't often take the luxury, of thinking about how do you take the long view on some of these issues. Chicago, just like any other city, didn't arrive at the challenges that it had overnight, and so the solutions are not going to be short-term solutions either. And so, you know, what I wish for any political season is that although a politician needs to think about being reelected, they also think about what's the long term and what's the long game and what's the long vision and how are you putting in place things that will live longer and beyond an election cycle, whether somebody gets reelected or not.
Let me ask you, and I know we don't have a lot more time, one of the issues I'm sure that's going to be in the forefront in this campaign is the violence in many of our neighborhoods. We have 77 community areas in the city of Chicago. The violence takes place in 12 to 15. Most of the shootings and murders are in those communities. How would you hope that that issue is addressed in the campaign?
Well, I think it's a serious issue. And I think there's both, again, kind of the short term as well as the long term. You know, I think at the root of a lot of violence is lack of jobs, lack of access to dignified work and housing and some of the core things that all people want for themselves and their families. And so I think there needs to be a long-term strategy as well as looking at how do you make sure that those who are involved in violence get the kind of direct support and intervention for interrupting that violence. You know, we in public health talk about violence as a public health issue, and that in fact you can use the same tools that you use for any contagion to actually interrupt the transmission of violence. And so, you know, I think looking at both how are you looking at much more of a community approach to it, looking at how do you look at the public health aspect of it as well as looking at the public safety aspect. And so I think there needs to be a balance between both prevention of the immediate issue of violence, but also looking at some of the root and long-term causes.
Okay, we're coming to the end of our time. Is there anything you want to say to our audience as we conclude?
The only thing I would like to say is thanks for this incredible opportunity to come here and serve. I look forward to many years of being part of this Chicago community. I hope people have some patience with me as I continue to learn, but I look forward to having a really strong partnership here with so many people who have been so welcoming to me since I've been here, including yourself. So thank you.
Thank you. Thank you very much.
Dr. Shannon, if you could join me. Thank you for taking the time to do this. Hopefully you can all see why we decided at the foundation to honor Dr. Gayle and the Chicago Community Trust. This year, Dr. Gayle and the Community Trust are receiving the Ruth Rothstein Award for Excellence, and we're honored to present it to them. Thank you for your time, your energy, your passion, and commitment to public health and the women and children, particularly tonight, that we serve. Thank you again.
The smallest listing in the world isn't a 90-square-foot loft in New York, or an 86-square-foot apartment in Tokyo, or a 60-square-foot studio in Hong Kong. It's 3.4 square feet in a hospital. In Chicago, 1 in every 10 babies is born premature.
She came at 4 in the morning, 2 pounds, 3 ounces. Of course, you pray for the best, but prepare yourself for the worst because you never know what could happen.
They told us that we wouldn't leave without giving birth. I said, but he's not ready. And they said, no, he's not ready.
There's nothing more vulnerable than a premature baby. All the basics of being alive, if you think about it, are provided for these babies. And all this intensive specialized care is extremely expensive.
To help support these families, Cook County Health created the tiniest listing, the first listing inside an incubator, allowing anyone to book a night for a baby in the neonatal intensive care unit.
We are dedicated to our patients. We want to serve them regardless of their ability to pay, and we want to give them the best care. And that's especially in our NICU. They see the NICU as their home.
Well, I'm really glad that we got to see some of the same people who took care of Vitaly back then.
They were just perfectly compassionate human beings. That's more of how I saw them, you know, like moving angels rather than people who are here to do a job.
Just by donations, that's the way that we can continue to do what we do and have the resources that we need to care for the babies. It's helping them grow, thrive, and it's helping them basically go back, transition home. Everyone wants to be with their mom, right?
There's really no way to describe the work that they put into keeping the babies alive and healthy.
It's hard. Yeah, it's hard not being able to take your baby home with you, but it's like a second family here, and she has like 50 moms, including myself and the nurses, so. I just talk to her and tell her to be strong for me, and I'm gonna be strong for her. And most of all, just let her know that I'm gonna be here, so she's not going through it alone.
To help give Chicago's tiniest community members a home, visit thetiniestlisting.com.
Testing, okay. Everyone in this room has faced a challenge at some point that has made them want to say, I wish I could explain. I wish someone could understand how hard this is. I'm Hannah. This is my partner, Greg, and our son, Vitaly. It's Vitaly's story that makes me say, I wish I can explain. I hope I can make you understand what an incredible thing it is that happened, which is that Stroger Hospital's NICU brought my son into the world and kept him here. One of the things that was surprising to me was how a premature baby overwhelms your senses. It's a creature that's so young that it looks very, very old. It's very much a tiny animal, not quite shaped right, kind of primitive, like a bug. So not necessarily a cute baby, except perhaps to us. So Vitaly was born at 25 weeks gestation, which was at the end of my second trimester, and he was 1.3 pounds. So like many of these micro-preemies in the NICU, he was a baby who was a fetus, and it is a really, really shocking thing to see. We were devoted to him, and we wanted him no matter what. We wanted him to feel the wind. We wanted him to see the sky. We let go of fairy tales pretty fast. We accepted that a lot of things might and would happen that would not be ideal, even if he survived. And it was very possible he would not survive, that he would be one of the 70% of preemies in his particular situation who would pass on. That's what we were told 2 weeks in or 3 weeks in when it was clear that we were still not winning. His lungs were heavily damaged. He relied on a ventilator. He had an open PDA, which he was too unstable to receive surgery for. And I'd sit and I'd whisper to him a song that really wasn't louder than the machine, so just white noise. And the song told him to keep breathing, little boy, as I would watch him desaturate to like 14%. And I would think, how does this body keep living? This tiny body in a plastic case in a deliberately darkened room to be like the womb. And the answer is that body lives because of the Stroger NICU. That body lives because of those people. People like Marie and Ginger, Angelica, Wilma, Cheryl, Jean, Melanie, Omar, Anna Lynn, who has magic hands, putting an IV into an arm that's thinner than a finger. And you've got to wonder, I mean, how thin is that vein? Genevieve, who was a baby whisperer. Luz, who gave me rides home at the end of her shift. Ophelia, who is a ray of light, and who came once and asked me, "Are you getting good care?" And I told her, I am getting the best care. Tish, the nurse practitioner, who would update us with new pictures of his lungs, which were whiter and more scarred, but she kept proposing and hoping. The doctors themselves, who always persevered. Paulina, taking photos of all the babies, devoted to all of them. And the doctors saying, "We're not out of the woods yet," or "We're not winning." But they take chances because that's how you win. I don't envy them that responsibility of making those decisions. Dr. Kamat, Dr. Rastogi, Dr. Malvia, Dr. Kumar, Dr. Maidam, Dr. Dre. And it was Dr. Rastogi who brought us out of the woods. After dexamethasone and switching ventilators again, we moved on to a new set of challenges, but without the ventilator. So all in all, Vitaly was in the NICU for 4 months. And we changed diapers, and we did kangaroo care, and we learned to breastfeed a little mouth that was really small. One of the first times that I got to touch Vitaly was when a nurse showed me how to change his diaper. The staff showed us how to do it all. They are devoted and resilient, compassionate, innovative. They're also matter-of-fact and tough. Greg and I learned to parent in the NICU, and our teachers were nurses. And then Vitaly came home. He became this boy. He became this awesomely beautiful boy. He is no more special than any child, but he is all of our children. He is the heart of my heart. He is a vital force, and there is not a day that I take his presence for granted, even when he is being a hellion. He's 4 years old now. He's in preschool. He's learning to read. He loves Sam and the Firefly. He loves Abiyoyo. He loves The Lion King. He loves the Rolling Stones and The Who. Because of his father, he also loves Beethoven. He'll make up jokes. He'll say, "Would you like 1 Brahm or 2 Brahms?" He'll observe that when he gets bigger, the car will be smaller. Or he'll say, "I eat your nose. If you don't have a nose, your glasses are gonna fall off." He can do a 500-piece jigsaw puzzle all by himself, except for the blue border. He faces his fears, and he climbs the spiderweb rope at the park. He loves Chipotle and macaroni and cheese and chocolate chip cookies. I was going to tell you he liked asparagus, but he passed that up for chicken tenders at dinner tonight. And he sings himself to sleep, and he sings loudly. And when he falls asleep mid-lyric, the house gets very quiet. So I wish that every child out there could be as lucky as Vitaly has been in getting the care he's gotten. We're grateful he was at Stroger Hospital, and we would not have chosen to have him anywhere else. He could not have received better care in judgment, strategy, guts, and vigilance. And Vitaly and all those babies cannot do with any less. There are a lot of babies. Their hands are full, and their beds are full. Any compromises to this standard of care could kill. There are no cutbacks without consequences. So one more thing. They had asked me in that interview what I would tell another parent in our situation, and it took me till I left to decide. I realized I would tell them to be realistic, but still hope. And to remember that this process is not an end of life vigil. It is a beginning of life vigil. So thank you, Stroger Hospital, and we love you.
I want to thank Hannah, Greg, and Vitaly for joining us this evening and telling your story and reminding us this isn't about the foundation or about the chairs, or it's about the docs and the nurses and the staff here that make this, who heal and who create life and reshape and give everybody hope. And so that was an awesome story. And we actually have some presents for you. Yeah, now you like me. So what do we got? We got, oh, not a little mac and cheese. You like mac and cheese? If I need that kind of reception, I can go home. How about some puzzles? The puzzles, and we got some books. And all kind of stuff. And videos. What's your favorite video? Wow. The Lion King? Wow.
That's my turn.
That's his dad's favorite. Well, thank you again. And I hope you enjoy.
Thank you very much.
Thanks a lot.